Moment though to the chair of the South African Medical Association representing doctors, Dr. ANGELIQUE, joining me now on the phone. Dr. Coetzee, good afternoon to you. Thank you for speaking to us at short notice on this developing story. You obviously have been kept abreast of the preparations made by government for an outbreak of the coronavirus. Do you believe we're ready for this?
I've said this before. We are as ready as we can be, and the readiness will also depend on the different hospitals, on the management of the hospital, how good and how well they prepared their staff in how to handle a crisis like this, whether there is enough protective gear out there in those hospitals, and then best of all, it is to get the message out to the public, the broader public there, in layman's terms. We cannot speak to the public in all our scientific language. We have to come down at the level of the patients to make them understand what to do in a case when this happens.
So your advice, I imagine, like the World Health Organization, wash your hands, stay away from someone who is coughing, and then if there's any concern at all, go straight to a doctor.
No. So no. I call it the ABC. The first thing to understand, yes, you are right, it affects one's airways. So because it loves the lower part of your airway, you will have a dry cough, but you will have a temperature as well. So it's a temperature, 38 and above, a dry cough, maybe a sore throat, and you will have the normal children feverish thing in your, of the body aches, I know, call it body aches and pains. But you will not have a stuffy nose or a running nose or sore ears. That's the upper part of the respiratory tract or the airways, and the virus doesn't really attack that. So if you have those symptoms, the best is to phone your general practitioner. We are trying to work with a guideline that we will distribute to the surgeries, which normally will be the first point of contact, where those secretaries will ask you a few questions. If you are positive on those questions, then it will be up with the general practitioner and you yourself to negotiate how are you going to see each other. Because if a doctor doesn't have the protective gear, he cannot see you because he will be then at risk. If the surgery doesn't allow for a certain area where you can see these patients, then you cannot see them because there will be a risk at other patients. So you cannot just go to the doctor. You have to phone. If you can just get this message across and be calm. Do not panic because 80% of patients will have mild symptoms. They would not even know that they've got the coronavirus. But stay at home and then consult via telephonic or other means with your doctor, but please just don't go into the surgery. Make some arrangements. And stay at home.
And Dr. Coetzee, all right, you're warning people to stay at home. Basically, we don't want to spread the disease. I presume you have your own networks, your own messaging system for doctors. Are you confident that all of the doctors in the country are properly aware of what they need to do, of the protocol, as this doctor was in KwaZulu-Natal, of the need to have a test and to send that test through?
No, I don't think so. I don't think our doctors are educated enough on their own ABC, on what to do. But I presume, and listening to what I've heard today, we already had a lot of questions from doctors. So from here on, hopefully, I think the awareness will grow, and there's a lot of platforms where doctors can get proper information on the scientific terms or in their scientific terms, understanding what's happening, what they need to do. But the problem is the public needs to understand.
All right, Dr. ANGELIQUE, thank you very much indeed. Chair of the South African Medical Association representing doctors there. You heard that very strong advice from her. Stay at home if you are feeling unwell and speak to the doctor on the phone and try and diagnose it that way. Of course, one of the big concerns now is to make sure that the disease does not spread.